Hi everyone, welcome back to our channel. Today we will continue the same topic or same question as a NORCET AIIMS. We will discuss the scenario based questions. Let's start. A patient develops urticaria, wheezing and hypotension after IV antibiotic administration. What is the nurse's first step? Option A. Stop infusion and maintain the airway. Option B. Administer hydrocortisone. Option C. Slow the infusion rate. Option D. Reassure patient. The answer is option A. Stop infusion and maintain the airway, because it's shown in the anaphylaxis. When the anaphylaxis occurs, at first we have to stop the drug, then we have to give the O2, then we have to give the epinephrine. Stop, then O2, then epinephrine. So the answer is option A. Next. A patient is receiving packed RBC transfusion. After 2 hours, the nurse notes dyspnea, hypertension and crackles. What reaction is this? Option A. Febrile non-hemolytic reaction. Option B. Allergic reaction. Option C. Trail transfusion related acute lungs injury. Option D. TACO, transfusion associated circulatory. The answer is option D. TACO, transfusion associated circulatory, because it's a fluid overload. When the fluid overloads occur, the hypertension, crackles and dyspnea occurs. So the answer is option D. TACO. Next. A psychiatric patient says, voices are telling me to kill myself. What is the nurse's priority? Option A. Document the finding. Option B. Provide reality orientation. Option C. Ensure patient safety and constant observation. Option D. Administer sedatives. The answer will be option C. Ensure patient safety and constant observation, because it's command of the hallucinations, it's risk for the suicide. At first we have to give the safety first. We have to constant observation to the patients and their movements. Next. A nurse finds a patient with tracheostomy tube dislodged and no spare tube available. What should be done first? Option A. Call the doctor immediately. Option B. Insert a foil catheter into the stoma. Option C. Cover stoma with dressing. Option D. Provide O2 through the face mask. The answer is option B. Insert a foil catheter into the stoma. Insert a foil catheter into the stoma is temporary airway maintenance with catheter until the new tube arrives. Call the doctor immediately. We have to give the priority first to the patient's airway, not call the doctor. Next, cover stoma with the dressing. No, never cover the stoma with the dressing. At first, we have the priority of the patient is airway. Provide O2 face mask. No, don't give the oxygen to the face mask. Give only the insert foil catheter into the stoma. Next. A patient with chronic renal failure has serum calcium level is 6.8 mg per day and complaints of tingling in fingers. What emergency drug should the nurse prepare? Option A, IV sodium bicarbonate. Option B, IV calcium gluconate. Option C, IV magnesium sulfate. Option D, oral vitamin D. The answer is option B, IV calcium gluconate, because hypocalcemia with tetany, we use the antidote IV calcium gluconate. Next, a patient with DVT, deep vein thrombosis, suddenly develops chest pain, tachycardia and hemoptysis. What is the most likely complication? Option A, pulmonary embolism. Option B, pneumothorax. Option C, pleural effusion. Option D, myocardial infarction. The answer is option A, pulmonary embolism, because this is the classical sign of the DVT. Chest pain, tachycardia and hemoptysis is the classical sign. Next, a 3-year-old child with nephrotic syndrome is at highest risk for which complication? Option A, seizure. Option B, infection. Option C, pulmonary edema. Option D, anemia. The answer is option B, infection, because this can occur protein loss in the urine. So when the protein will be lost, the immunity will be decreased. So the answer will be option B. Next, a patient with acute stroke develops right-sided hemiplegia and dysphagia. What should be the priority intervention? Option A, insert NG tube and start feeding. Option B, keep patient NPO and assess swallowing reflex. Option C, encourage oral feeding with soft diet. Option D, start IV fluids with the dextrose. The answer is option B, keep patient NPO, nothing per oral, and assess the swallowing reflex, because it can prevent the aspirations of the pneumonia. So the answer is option B. Next, a patient on nasogastric feeding develops diarrhea. What should be the nurse do first? Option A, stop feeding immediately. Option B, change formula concentration per rate. Option C, give the antidiarrheal drug. Option D, administer IV fluids. The answer is option B, change formula concentration or rate, because hyperosmolar or rapid feeds causes the diarrhea. So at first we have to change the formula concentration or the rate. Next, a patient with liver cirrhosis develops confusion. Lactulose is prescribed. What is the purpose of the lactulose? Option A, improve the appetite. Option B, reduce the ammonia absorption. Option C, prevent the bleeding. Option D, increase protein absorption. The answer is option B, reduce the ammonia absorption, because lactulose traps ammonia. what they will do? Lactulose strap the ammonia in the stool. So prevent hepatic encephalopathy. So the answer is option B, reduce ammonia absorption. Lactulose did like that. Next, a patient with Addison's disease suddenly collapses with hypotension and shock. What emergency drug should be nurses prepare? Option A, epinephrine. Option B, hydrocortisone. Option C, dopamine. Option D, insulin. The answer is option B, hydrocortisone, because it's showing in the disease is Addisonian crisis. So when it occurs in Addisonian crisis, then we have to give IV hydrocortisone immediately. So the answer will be option B. Next, a patient with COPD develops worsening dyspnea, clubbing and polycythemia. What complication should the nurse suspect? Option A, pulmonary hypertension. Option B, pleural effusion. Option C, pneumonia. Option D, AIDS. The answer is option A, pulmonary hypertension, because chronic hypoxia can cause pulmonary hypertension. STN hypertension can cause the cor pulmonale. So the answer is pulmonary hypertension, option A. Next, a patient on heparin infusion develops sudden hematuria and gum bleeding. What antidote should the nurse keep ready? Option A, vitamin K. Option B, protamine sulfate. Option C, atropine. Option D, naloxone. The answer is option B, protamine sulfate, because protamine sulfate is an antidote for the heparin. So the answer will be option B. Next, a pregnant woman 36 weeks present with the sudden abdominal pain, vaginal bleeding and tense, rigid uterus, fetal heart sound are absent. What is the most likely diagnosis? Option A, placenta previa. Option B, approbation placenta. Option C, uterine rupture. Option D, preterm labor. The answer is option B, approbation placenta, because approbation placenta main sign is vaginal bleeding, abdominal pain, sudden and rigid uterus, fetal heart sound are absent. So the answer will be approbation placenta. In placenta previa, no painless vaginal bleeding. So the answer will be option B, approbation placenta. Next, a patient with Guillain-Barré syndrome is admitted to ICU. Which assessment is most critical? Option A, pain level. Option B, muscle strength of lower limbs. Option C, respiratory rate and effort. Option D, bowel sound. The answer will be option C, respiratory rate and effort, because in GBS ascending paralysis occurs. Ascending paralysis occurs. It can cause the respiratory failure is life-threatening. So the answer will be option C. Thank you everyone. If you are liking the video, please like our video and subscribe our channel. Thank you everyone.